Welcome to IELTS Preparation in Conversations, your go-to guide for mastering international English exams. Whether you're aiming for IELTS, TOEFL, or any other exam, we're here to help you prepare, practice, and perform your best. In today's episode, we'll be discussing healthcare for all, offering valuable insights to boost your confidence. So get ready, take notes, and let's get you one step closer to your goal.
You know, James, I was just reading about how access to healthcare varies so much across the world. It's honestly heartbreaking how some people can get top-notch treatment in one country, while others struggle just to see a doctor.
Yeah, it's crazy, but isn't that just the way things are? I mean, some countries have more resources than others. It's not exactly a level playing field.
That's true. But shouldn't healthcare be a basic right? I mean, in some places, people have to walk miles just to see a doctor. And even then, they might not get the treatment they need because of the cost or lack of facilities.
I get that, but let's be real. Free or affordable healthcare isn't easy to provide. Take the US, for example. The system is so complicated, people either have insurance and still pay a fortune or they don't and end up avoiding hospitals altogether. Meanwhile, countries like Canada and the UK have universal healthcare, but then you hear about long waiting times and overburdened hospitals.
Yeah, no system is perfect, but at least in universal healthcare systems, everyone gets access. I'd rather wait a little longer than go bankrupt because of a hospital bill.
I don't know. I've heard stories of people waiting months for surgeries in some of those countries. If you need immediate care, that could be dangerous.
True. But what about the millions of people who don't even get to see a doctor in the first place? In some developing countries, hospitals are understaffed, medicines are scarce, and people rely on home remedies because they can't afford treatment.
Yeah, that's the part that really gets to me. It's not just about money. It's about infrastructure, trained professionals, and access to medicine. Even when aid organisations step in, it's like putting a bandage on a much bigger wound.
Exactly. And let's not forget rural areas.
Yeah.
Even in wealthier countries, if you live far from a city, finding specialists or even basic healthcare can be a nightmare.
Yeah, I actually know someone who had to drive for hours just to see a specialist. That's a real issue. But what's the solution? It's not like every country can suddenly afford to build hospitals everywhere.
Well, technology could help. Telemedicine is already making a difference. In some places, people can consult a doctor through their phone, which saves them a trip and gets them quicker advice.
That's a good point, and I guess investing in more mobile clinics and training local healthcare workers could make a huge difference in remote areas.
Exactly. It's not about finding a one-size-fits-all solution, but making sure that wherever someone is, they have some form of access to care.
All right, you win this one. Healthcare should definitely be more accessible. I just wish it were that simple.
I know, me too. But talking about it is a start. The more awareness there is, the more pressure there is for change.
Couldn't agree more. Thanks for the chat, Leslie. I always end up learning something new from these debates.
Same here, James. Now, how about we walk to the next cafe instead of driving? You know, to stay healthy.
All right. No need to turn this into a health intervention. Let's go.